got into a medical device startup. And I tried that for years, and it didn't work out as a business, but it led into a lot of interesting medicine and science.
Okay.
And so that was the origin of the book Healing Photons. And then I got off into other kinds of science, and I've been doing other kinds of things for the last 10 years. But surely this is something near and dear to me. The whole question of UBI or biophotonic therapy, whatever name you want to give it. It's very important to me. So I'm happy to be talking to you about it.
Well, you wrote your first book 20 some years ago, The Healing Photons, and you were at that point in time, what was the impetus was it that you were trying to get a machine going, or was it that you just had a lot of interest in it and just started doing the research, or how did that work?
Well, it was both. It was that, yes, I was trying to get a device that would get into the market, and that didn't work out. But in the process, I thought, where is the real research been done? Yes, there were some very interesting old American studies, but not a whole lot of them. And the main research was in Russian and in German, and I happened to read both Russian and German because I'm an historian.
Yeah.
And so I thought, okay, this is a perfect thing. Go and read all that literature and write it up. It will boost the credibility of the therapy, and also it will give people who are working with it, practitioners, notions of what they should and should not be doing.
Right.
I have met with a number of practitioners, and in particular, I think Stuart Wegg was a well-known, I don't know if he's still in practice now.
Name doesn't ring a bell, but
Stuart Wegg, he was an anesthesiologist.
Okay.
And he started using the device in order to treat cancer pain, intractable cancer pain.
Okay.
And ended up treating hundreds and hundreds of patients based in New York and New Jersey.
Okay.
And so I've dealt with him.
Yeah, great. Well, let's see. Some of the information, about biophotons, and again, I'm more of a reporter investigator than I am scientist, even though I've got a science degree and so on. That was way back when. But, the idea of biophotons traveling around the system and causing all of the things that it does, are there other things besides the UBI or, the intravenous laser light that gets light somehow traveling around like that, or biophotons?
It can happen naturally.
Okay.
For instance, during the American Civil War, surgeons would go into tents with a number of wounded men in them, and they would see at nighttime that the wounds of certain of the soldiers were glowing in the dark. But not wounds of other soldiers. And they determined that the ones whose wounds were glowing actually were more likely to survive. And they called it the phosphorescence of wounds.
Okay.
But pretty clearly, that is some kind of natural human healing reaction involving biophotonics.
Okay.
And what stimulates it, why there were certain ones among these soldiers who had that reaction, and why others didn't, we don't know. But it's an example of how this is very much a natural process, not necessarily something that has to be stimulated from the outside. And so the question is how to work with that natural process.
Yeah. So the heliotherapy of the sun and the tuberculosis, and it seemed to have some really good effects, but it's not used anymore. I mean, who puts people out in the sun, except kind of alternative medicine knows a little bit like, yeah, get outside, get some sunlight, Any ideas on that of what happened, or?
Well, one very good reason was that tuberculosis became much less common in Western Europe and in the United States. So there just wasn't the need. I think nowadays there are a number of phototherapeutic methods that are being used by the doctors and for skin diseases by dermatologists. That's a very active field of practice and of research. But by the very same token, they don't need to go outside into the sun for the purpose.
Yeah. Huh. So was it hard to dig up the Russian studies? It's kind of regressing on the questions, but.
Not hard, because I live just 3 metro stops from the National Library of Medicine, which had, and especially during the time of the Cold War, but even thereafter, has had a terrific collection on Soviet and post-Soviet medicine.
Okay. Now, I don't know how active they are. I had a chance 8 years ago and went to the Ukraine and talked with, it was one of the medicine ozone conferences, and they let me come and speak, and they kind of looked at me funny because we talked about drawing blood out, and they thought that was pretty strange at that point. But is there a really active at this point fiber optic laser therapy in Russia, do you know? I know Weber's over in Germany, and UVLRX tried it here in the States a few years ago, and I met those people. But yeah, do you know more about that?
Yes, it is very active, but not as active as before. And you can see the very active side right in the corner. If you look at the picture back there, there is a device sitting there. That is a new device, which I have acquired from a company in Moscow.
Okay.
It's a low intensity laser at 632.8 nanometers in the red spectrum, but also at 365 nanometers in the ultraviolet A.
Yeah.
In fact, 365 was the most, the fullest employed of all the wavelengths in Knott's original device.
Mm-hmm.
So it's clearly not going to be, as I haven't started using it yet, and I still have to translate the instructions, but it's going to be somewhat, I think it will be not as effective as the extracorporeal because that has many wavelengths, but it will be more effective for some purposes than the red laser.
Yeah.
632.8 laser. And the other aspect of the Russian thing is that with the collapse of the Soviet Union and the turmoil in the economy there, a lot of foreign drug companies moved into Russia. Russians had never been strong in making drugs, and that's one of the reasons that they got big into UBI. Because they needed a substitute for drugs.
Yeah.
And so the drug companies have tended to form alliances and pressure and so on that have moved Russian medicine to some extent away from the biophotonic therapy or ultraviolet radiation.
Yeah.
Comes to the question of whether it's better to treat with a combination therapy or with a monotherapy. And in my book, you'll notice that at several points, I do sort of come down on the side of the monotherapy. Yeah. One benefit of treating with a monotherapy, at least one at a time, is that you can know what to ascribe the effects or counter effects, whatever. Yeah. You know what's going on. Whereas if you're using 2 or 3 therapies at one time, you don't.
Yeah.
And you could make a mistake that way. So using UBI as a monotherapy, it's been shown with the correct device, the correct technique, and so on, it can have very excellent results. And so I tend to favor that. But I can certainly understand the wish of a patient, and especially in a fulminating condition, a life-threatening condition, you just want to throw everything at it that you can. That's understandable.
Yeah. And I did run a clinic for a year, so we had solo therapy on probably 400 to 500. It was an outpatient type situation. So I got to see just pure and simple, plain. They might have been doing other things at home, but it was jaw-dropping what it did. Now, reading Douglas's and Rebick's and Miley's and these guys' report, a lot of times it seems pretty severe disorders were helped with just one therapy. I mean, one single therapy. I don't think we're seeing that like people with Lyme or with EVB and chronic stuff that's out there. We're not seeing a single therapy doing this like they did. Any ideas on that?
Well, the main idea is that the Knott hemo-irradiator, the original device, was a very powerful device.
Yeah.
And because it used a mercury lamp,
Yeah.
it was later frowned upon. It was, you couldn't do it. You can't use a mercury lamp because there's a danger to the operator.
Yeah.
And so people have since that time tried to replicate the power of that device, and they've not totally succeeded. And I think that's the explanation why there's been somewhat less success.
Well, one of my concerns is that although we can ramp up the energy, how do I know if what's too much? Is there any kind of a test we can do to say, okay, let's just flood this, but you don't want to do that with people and not really knowing what's going on. We're very safe in what we're doing at this point. I mean, just thousands and thousands and thousands without side effects, without problems. But at the same time, I'm kind of going, do I need to make a stronger machine? Or should I just be happy with where we are? And is there anything we could do to test the idea that, okay, if I ramp up the energy, what should I look for that would say, uh-oh, too much?
Okay, let me step back a little bit from it and then get to that. One of the key points is that UBI is an immunomodulator, and that means it's two-sided. If you use a small amount of it, you're likely to stimulate the immune system. And that can be surprising to people. It can lead to what's called a healing crisis. For instance, if you're treating a patient with bronchial asthma, and you give one treatment of UBI, it can exacerbate the condition. Mm-hmm. And you have to explain to the patient that this is the way it works. It's a bimodal thing. If you keep treating the bronchial asthma a second, third, fourth time, by the fourth time, you're likely to be suppressing those same cells that were activated by the first one. So actually, the activation of those cells in the so-called healing crisis is indicative that you've targeted the right cells and that you will succeed if you just continue. But the danger that exists, and I know of one case of this. I was in contact with a patient, was that the practitioner didn't really know an awful lot about the therapy. And he mistook its action in an infectious disease. He thought he should be treating it as if it were an autoimmune disease, in other words, requiring much more therapy. So he overdosed, and she had a lot of side effects. So she stopped going to him.
Sure.
So that's it. But to answer your big question, I think at a certain point, you're supposed to do it as they did it originally. If you're the physician, you treat and you watch. You treat and watch. Yeah. And it's a question of the physician's art to a certain extent.
Mm-hmm. You mentioned UBI and cancer. I've always been a little skittish. Not that I think UBI is going to hurt. Obviously, if you have anti-infection, anti-inflammatory, vasodilation, oxygen uptake, all those things are good for a cancer patient. Are we really getting at cancer with UBI? Like you talked about the one guy who worked with it. What's your experience and what's your thoughts on UBI and cancer?
Okay, I would distinguish between two applications. The one is what Dr. Stuart Wegg has been doing for many, many years, and that is treating the surrounding problems connected with cancer. Very important, pain, a terrible problem in
Yeah.
cancer. And UBI is very effective for that. But the second thing is treating cancer itself. There have never been reliable, consistent results. The best we have are, we have some anecdotes that occasionally it seems to have worked. And one can see how that might have happened in an individual case. It might be like those soldiers in the Civil War in the tent,
Yeah.
that somehow the UBI or biophotonic therapy stimulated that original immune system, that chemiluminescent biophotonic immunescence, and that would go after the cancer.
Yeah.
That's how I could conceive that it would happen.
Okay. And that's good. That's a good answer. Hyperbaric oxygen is used by some doctors to get oxygen into the system, but it seems to only stay for a short-lived period of time, although it can have some really good effects. If you were going to compare hyperbaric with UBI, is there a comparison, or can you think about that?
I don't know the specifics of hyperbaric, but what will happen with the strength of the UBI is that you're treating the entire system, and that means you're treating the blood flows everywhere and just about everywhere, and you're stimulating, for instance, the entire immune system through the blood, and also you're reaching into the bone marrow. So a lot of the results that you get that are surprising with UBI could come 10 or 15 days after the treatment, when the newly the bone marrow has been stimulated by the light and now is putting out the right set of cells and so on. Then you get a very excellent sort of late effect. And that's particularly true with the UBI, not with the laser biophotonic therapy.
Okay. I noticed that they talked about there's an increase in, new red blood cells, and I'm trying to think of where that was and who tested that, or is it just kind of a theory, or have you read?
No, I can't recall exactly. It's somewhere in the book.
I can find it.
But they did a lot of testing it as an oxygenating therapy in the beginning, and they were just interested in what was happening to the blood. And so that's a known effect, that the blood becomes oxygenated and that the red blood cells take upon themselves their optimal ovoid type appearance, so they can fit better through the microcirculation. And in general, it normalizes and optimizes the blood seizures. In all of those cases that the Russians were using it, they were using it as a neurological drug to oxygenate and repair blood cells that would be going into the brain, or perhaps some of the tissue of the blood vessels that would be going around near the brain, and they were not treating. It was not like a chemical treatment. It was a treatment with light, although light is a drug, and must be thought of in terms of pharmacology. But in those and other psychiatric problems or quasi-psychiatric problems, you can see the value of a therapy that optimizes the blood and oxygenates and so on. And I think that was the basis of its effectiveness. that the Russians found. Obviously, all that needs a whole lot more research.
Yeah, yeah, for sure. You know, the fiber optic with the red light, one of the comments I've read is that, of course, red light does not absorb into red blood cells very well. It's kind of a low level, 5%, 10% maybe that is able to be absorbed. But I know they've used the red laser for a lot of different things, you know. Any ideas on that? It just kind of, I'm scratching my head going, well, it looks like 410, 420 really absorbs a lot in the blue, deep violet areas and UVA, obviously, but you get into red light and I'm going, sounds like it's just skipping around. But there's something else.
Okay, the answer, the most obvious answer to me seems to be that instead absorption is surely going to have an effect inside the cell, but also stimulating, pinging an effect on the cell from the outside is also going to affect its level of activation and so on. The fact that the red cells reflect red laser light doesn't make much difference to me. It just is, that's the way it happens to activate the red blood cells.
Yeah.
And also, presumably, it's also activating the white blood cells.
Right.
We don't, the biggest unknown in the whole thing is what is the role of the red blood cells in immunity and disease and so on. They're sitting there absorbing a lot of energy, and clearly they are 700 to 1 versus the white blood cells. They are the main component of the blood. What are they doing? Dr. Voykov, Professor Voykov at Moscow State University said to me, he said, you know, in all of his experiments with red blood cells, he's never seen an instance of them emitting biophotons. Unlike all the other cells in the body, they're not emitting biophotons. So what is going on?
So there's a mystery yet to be solved, right?
Oh, plenty.
Have you read Michael Hamblin's work at all?
Everything he says, I agree with.
Yeah.
But you can see how we all get trapped by the, in my book, I did, by having to talk about all these other things that are not ultraviolet blood irradiation, because people start asking about them. And he makes clear, I think it's very important, that biophotonic therapy, or UBI, is an in vivo therapy. It's not an in vitro therapy. But because people have done all those studies, he had to report the studies that were in vitro. And that's the way many scientists and even many medical doctors who don't know anything about it, that's the way they look at it. They look at ultraviolet is supposed to be germicidal for transfusion medicine, which is correct.
Yeah, sure.
But going right back to Emmet Knott, the UBI doctors made it clear that UBI is not an in vitro therapy, and you cannot extrapolate from the in vitro results or the in vitro thinking to what's going on in the body.
Yeah, great. Emmet Knott killed his dogs. You said in the book the Russians did a similar study after that, and the dogs all lived. What happened, that shut these dogs down? And I think your response was, well, our level of UBI now is so much less that you could probably do it to the dogs and do all the blood and it didn't have a negative effect. But, any ideas on that, of what shuts down when he just did the whole body?
What can in effect, if you would by mistake give a big overdose?
Yeah.
I really don't have a solution to that. And I think I would, if I were actually a practitioner, which I'm not, I would observe the rule of treat and give them a treatment, then wait, and another one, and wait and observe. So you don't ever get in the situation. My sense is overdose is nowhere near as big a problem with UBI as underdosing is.
Yeah.
Many physicians who don't really know it so well, and other practitioners who don't really know it so well, are timid, and they're afraid to use it at a higher volume, so to speak.
Yeah.
But that's a mistake.
Yeah. What are your thoughts on this COVID situation? I mean, there's so much information, and I shake my head on all the lockdown things, but I'm a little bit of a risk taker anyway, so, you know.
Yeah. On COVID, it is undeniably true that a medical crisis of this sort provides a window of opportunity
Yeah.
for therapies such as UBI,
Yeah.
but many others, to get attention and possible funding that they haven't been able to get for decades.
Yeah.
As far as I know, the National Institutes of Health have funded a single study in 90 years, a single study of UBI, and that was as an adjunct therapy of hepatitis C.
Yeah.
Apparently, it performed credibly, but you know, it was a very minor bit player, so you really couldn't tell. And that's all the funding that has gone into it. And so there's a real problem there of scientific rejectionism and so on. That's a big question.
Yeah, yeah, it is. We'll see if something comes of it. I'll certainly tell you. What advice would you have for me as I get out and we do a lot of training and we talk to a lot of doctors? I'm, you know, obviously they're the heroes. I'm just a guy helping them getting machines and so on around and some training in it. But got any thoughts? You know, and I'm trying to put together a book. I felt Campbell Douglas is a little old and needs definite rework. And things have changed, you know, in the last 10 years.
Sure.
So
I think it would be useful if everybody concerned, and this is internationally too, would organize a kind of society. Of course, you'd immediately run into the problem, what name do you call the therapy? But let's not worry about that. A society for this kind of treatment of the blood with light.
yeah.
I think that would be a useful step. So that's one thing to do. A second thing is to find ways to do clinical trials. And I have an idea right now with this Russian device of how to do it. And of course, the therapy couldn't be more appropriate for the challenge of the serious cases of COVID-19, because it is an oxygenating therapy. Yeah. It has a long track record of treating pneumonia, and it has a long track record of treating disseminated infectious diseases. Yeah. So it couldn't be, it would seem, it couldn't be more appropriate than to use it. It's really a tragedy that they've been using instead ventilators and all that. They should be treating with BT or with UBI. However, I can say that, but that's not going to get any effect. I think the more we talk about it and the more we come up with ideas such as clinical trials, that for instance, one of the activities that could be expected of UBI is to suppress the so-called cytokine storm that is such a problem for the doctors treating the COVID-19 patients, the serious ones especially. So talking up all these things and possibly writing, I have not had much success in publishing in standard journals, but trying to persuade the doctors who are interested and scientists and so on. So there's a real opportunity now
Yeah.
And since the epidemic seems, or pandemic seems determined to go on for quite some time, this window is still open.